Well, surprisingly, among the many infections that can be quite serious, the one that affects more people with asthma, and possibly also with food allergy, is the common cold, which is a rhinovirus infection. So for some reason, people who have this allergic tendency, they seem to overreact, or this system is primed to react too much to this common cold virus, and they start from very mild symptoms going all the way up to very severe exacerbations. We also have the suspicion that some of the food allergy reactions are associated with such a viral infection, possibly as a cofactor, as an additional factor that can help the development of the food allergy reaction. Well, we have this hypothesis, as is in the case of respiratory allergies, that also in food allergy you need to have more than one factor in order to have a clinical reaction. In the case of food allergy, we know that if you eat enough of the food, of the allergen, then you have a reaction. However, we also know that the level of reactivity, what we call the threshold, can change. So it is possible, and we see that in clinical practice, but it has not been proven the mechanism has not been shown in research, so that there is a lowering of the threshold when you have the infection. So something happens when you react to the viruses usually, and make you more susceptible, so you can have the reaction with much less food. Well, that's really very interesting. We are very much into looking into the ecology of the respiratory tract. So not only specific infections, but also all the microorganisms that live within our respiratory tract. And this is the microbiome, which has become famous, but we are focusing more on the viral aspect of it, the virome. And what we find is that there are possibilities perhaps to re-establish a balance in a system that has been unbalanced because of the immunity, but also because of the wrong microorganisms being there. And there is a possibility, this is what we are proposing in a recent project that we are running, in a European project called CURE, that we might use some viruses in order to combat bacteria or re-establish the balance. So we might even use an infection to combat an infection. The program that I've just described about the possibility of manipulating different viral populations is extremely novel. So there are lots of possibilities, and now there are some other groups as well looking into these balances. So there are different possibilities in terms of conditions and diseases. We're focusing mostly on asthma, but you can have the same type of reasoning applied to food allergy or to, let's say, rhinitis, conjunctivitis, many other diseases, and also different types of approaches, like, for example, prognostic approach or preventive approach, or therapeutic, depending on which type of patient might benefit more. So there are several possibilities, and I think we are opening a field for these possibilities to be explored. Information about pollen can be very important to the patients that know that they are allergic to that pollen, because they can plan their day. But it's not only about planning, it's about the information per se, knowing what is your problem and knowing that you have an increased risk of having this problem makes you be more careful, or you take your medication. So I think this is very important information to have. And it is commendable that both the local science team and EAACI has helped in establishing this information. This is something that should happen and should be there in everywhere, in many countries. Well, what is interesting and state of the art nowadays in allergy is oral immunotherapy. There are many different protocols developing, and we are also developing and exploring different ones or new ones in our research center. And I would be very interesting to listen to different presentations with people, doing different types of approaches for food allergy immunotherapy. Well, I'm actually very happy when I see new people joining EAACI and following the congresses. It's a very rich event, so the danger is that somebody gets lost with all this information. So I think what I would suggest is that people are organized from before, so they know what they want to listen. They need to keep time for networking, because that's very important, meeting new people and discussing things that are not in the papers and not in the presentations, but having this preparation, focusing on what they want to hear and keeping a balance between the information that they get and the interaction. I think this is probably the best experience from the Congress. Well, this is not a very easy one. It's not easy to choose among so many sessions, but now of course there are opportunities of listening to sessions after the Congress, so you can take advantage of that as well. And again, you need to have thought from the beginning what are the more important things, especially the ones that you would need, or you would like to interact, to make questions, to meet the people, the speakers, and discuss with them. So this should be the priority. And it should be included in this balance between all the information that you want to get and the time to discuss and interact with the rest of the people here. There are several challenges with allergy and allergy management. One challenge that is increasing nowadays is the availability of extracts for testing and immunotherapy. Because of increasing regulatory demands, it's more and more difficult for the companies to produce a wide variety of products. So more and more they're focusing on producing better quality, but smaller variety of products. And this has an effect on the possibilities of the allergists and the allergy community to treat their patients. We have already been in contact, and we are talking to regulators like the European Medicines Agency, for example, in order to try to improve this regulation, which is particular for allergy, because we have so many different potential allergies, and we need to find ways in giving, of course, the best that we can to patients, but not stopping that because we cannot produce, let's say, an ideal drug. Well, if I had to give one take-home message, is that life is complicated, allergy is complicated, but science is going ahead with big steps. And every year we have new things to offer to our patients. These years we have new biologicals, we have new immunotherapy treatments, so people should be aware of all these new things and try to bring it back and try to offer it to their patients.